All right, good morning, everyone. So this procedure is for a client who is having a complete bath. So the first thing that you will do is to greet your client and introduce yourself. So, hi, good morning. My name is Karen, and I'm gonna be your PSW for this shift. Okay, let me check your identification. Would you be able to state your name and your date of birth? All right, thank you. So how do you want to be called? All right, Mrs. Smith, thank you. So, yeah, after that, you have to explain the procedure to your client. So we'll be doing a complete bath for today. But before that, I'm gonna ask you if do you want to pee or do you want to void or do you want to take a poop. So you could offer your client a bedpan or a urinal. And so, okay. Um, Before we start, I'm gonna gather all the equipments and do my standard procedure. If there anything you want, you can call me by pressing the call button. Okay, all right. So before you leave your client, you have to make sure that the call button is within reach, the side rail are up, and make sure that the bed is in the lowest position to prevent them from falling. Okay, so after you gather all the equipments, you have to make sure you provide the privacy. If you're working in a facility where there are 3 or 4 clients, you can use the curtain to draw to provide privacy, and you can close the window. All right, and then um, you have to use the over bed table. You have to put towel on it, and then you can arrange all the equipments or supplies that you're going to be needing. So cover your client and make sure that the head of the bed is in comfortable position. As much as possible, you can put pillow on it, and then you can raise the height of the bed in the comfortable position. So after you've done all of those things, so you're ready to do the complete bedding. Before you get the water to the basin, you have to make sure that you don't leave your client um, in the highest position. You always have to lower the bed in the lowest position and make sure that the call bell is within reach. So you have to make sure also that the water you have you're able to check on it by using a bath thermometer, or you could ask the client if the temperature, if they're okay with that the temperature. All right, so um first thing you will do is that you're gonna need a washcloth. So there's a technique when using a washcloth. So I'm just gonna show it to you. So you just have to fold it like this lengthwise to cover up your arm, your hands, and then just fold it like this, and you will have this kind of a mitten. Okay, all right. So to start with, we have to use the principle of bathing, which is the cleanest to dirtiest and the farthest to nearest to you. So before you start, you have to ask your client to move a little bit closer to you, or help them to move a little close to you, so you could work well. And then if the bed rails is up, you can just put it down. Okay, in cleaning the eyes first, you could start with the eyes. So um you have to remember that in cleaning your eyes, the eyes of the client, never ever use a soap, because the soap might gonna irritate the eyes of your client. So from farthest from you, like for example here, this is the farthest from me. So you have to clean it inner countess to outer countess. You have to do it again, repeat it again to the clean side of the washcloth from inner to outer. And then you can rinse it. You can do it again, inner and outer. Okay, you can use you can do that into the nearest eye from inner to outer as well. And then after which, if it's dry, the eyes is dry, now you can ask your client, Mrs. Smith, do you want to use a soap to your face, but for to wash your face, or would you want a facial wash for your face? If the client says yes, okay, you can proceed. But most of the time, the clients don't really want soap in their face because, you know, it might irritate them. So you can start on the face. You can wipe the face down to their ears, then to their neck. Yes, you can repeat it until the soap is gone. It's not soapy anymore, it's not soiled. And then you can use a towel that is in their chest to pat dry. But do not scrub the skin. Uh, do not, do not dry the skin vigorously. All right, because when you're age, the skin is so fragile, they're thin, so you have to make sure you always pat dry. Okay, so when we're done in the face, now you can proceed to the arms and legs. So what you're gonna do, if the water is not clean enough for you, you can change it, and then do not leave your client in the highest position. You always lower the bed. You have to make sure the side rails are up and the collar is within reach. Now let's proceed to the lower part. To begin with, you have to undress to remove the garment. You have to remove the garment of the client, exposing only the areas you're gonna work. Like for example, the arms. So you're gonna start at the arms. And starting the arms, you could put a bath towel underneath their arms so that it will prevent from soiling the linen. So after that, you could assist your client with your other hands, with the assistant, from doing a long firm stroke. In doing a long firm stroke, this is from distal to proximal. Why are you using this kind of stroke? Because it increases the blood flow going to the heart. So you start from the farthest nearest, you're going to for your arms, going to your armpit. So you have to do it until the soap is gone, and rinse it very well. So you do it to the other arm. Now let's proceed to the client's hands. Always remember that if you see the client's hands are easily soiled with feces or food, you have to soak them for at least not more than 5 minutes. And to do that, you have to get a basin and put a towel under the basin. You can soak the hands of the client. So after 5 minutes, you can use the orange stick or a nail file, or something to clean the fingernails, to remove those debris on their fingernails. And then after that, you have to remove the basin, put it on the table, the overbed table. And then you can ask your client, hello, Mrs. Smith, can you be able to exercise your hands? All right, if your client is unable to exercise their hands, you can help them as well. Okay, you do the procedure to the nearest to you, the other hand. Oh, yes, the other hand. And then pat it dry. And then, yeah. So, now we're finished on the arms. Now we're going to the chest level. But before that, you have to change the water. Again, you have to make sure that your client is safe. You have to make sure the cowbell is within reach, the bed is lowered, the side rails are up. So when you check it, you always check the temperature. When you change it, you always check the temperature of the water. So now, cleaning the chest part. So you have to use a bath towel. In covering your client, you make it horizontally, exposing only the covering the area where you're gonna work. So when you put it the towel, now you're gonna pull the linen inside until their waist level. So you can start working on the chest by simply lifting the towel and then wiping on the breast area. You have to focus under the breast area because sometimes your clients may sweat, and you know those creases are, you know, prone to sweating, and sometimes when you're sweat it doesn't feel, you know, the smell's not really good. So and you have to make sure that you make an observation on that. So when you're done, you rinse it, and then you rinse it very well, you clean it very well. Now you can proceed to the abdomen. Now for the abdomen, you have to reposition the towel in a lengthwise position, right? And then you can proceed to the abdomen. For the abdomen, you always have to observe for also for any changes, if there's, you know, redness, if there's any, you know, there's a lesion or anything that it's alarming to you, you could report it to your client. So when you're done at the abdomen, now you can pat it dry, cover the client. Now after that, for the abdomen, you can change again the water. If it's really soapy or it's dirty, you can change it. But everything that you do, everything that if you need to go and change the water, you have to make sure that your client is safe. Like I've been mentioning, like you have to make sure the cowbell is within reach, um, the side rails are up, the table is at the table, the what do you call this? The the bed is in the lowest position. Now, let's proceed to the legs of the client. Now, for the legs of the client, now you have to make sure the client is covered up to here. So the sheets, you have to pull the sheets over here to make sure that the client's private area, like the breast, is covered, and to make it him or her warm. So in working with those legs, you have to put towels underneath. This is to prevent from soiling the linen. So you only expose the area where you're gonna work. Do not expose the genital area because you're not working on it. So using the long firm stroke again, you have to yeah, you have to start from distal to proximal, repeating the steps until it's clean. Right, both legs. Now for the toes, if you're working in the toes, if you any see debris or anything like under the toenails, you could soak the feet of the client, like what you do to the hand of the client. You can soak it 5 minutes. You can use an orange stick or a nail polish, and then you can ask your client, Mrs. Smith, are you be able to flex your knees? If your client is able to flex their knees, it's better. So you can work on it, and then you, if not, you can just help them. So after that, you have to clean in between of the fingernails, the finger, yeah, no, those toes. You have to clean them very well, and then massage it, the client's the feet, pat it dry, and make sure that it's all dry and clean. Now, let's proceed to the back of the client. For the back of the client, you make sure that your client is covered, and ask your client, Mrs. Smith, can you turn around? Okay, when you turn on your client, you have to help them, If they're able, that's good. You're still gonna help them. So exposing their back part. Now for the bar part, you have to make sure that you covered your client, that's exposing the butt area or even the breast area. Now in before you do the back area, if necessary, you have changed the water, uh, and make sure that the water is in the right temperature. You're not burning your client. And then now you could inspect your client's back. You have to make sure that you note a very important part, which are some of the client are prone to, like the bed sore, the cubitus ulcer. You have to make sure, you have to make note on that. Now in cleaning the back of the client, you have to start at the back of the neck towards down to the end of the buttocks. Do it continuously, continuous stroke, and then rinse the cloth, and then do it again until it's dry. And then you have to pat it dry again with a towel, and then position your client going back to lying bed. All right. Okay. Now I'm gonna discuss it to you on how to clean the perineal area for female and for male client. For female client, of course you have to change the water. Make sure the water is um, not gonna burn your client. Make sure that before you do that, you have to make sure that the client is safe, right? And then in doing a perineal care to client, you have to ask your client, Mrs. Smith, yes, can you flex your knees for me? If your client is unable to flex their knees, you could help them flex their knees. Uh, why are we positioning this female client flexing their knees? So that it is, you could clean it very well. You could see it very well, the area where you're gonna work on it. Now, for cleaning the area, genital area of a client, using a clean cloth again with a soap, using a stroke. Okay, I'm gonna use this to show it to you. So like, let's say for example, this is the vulva of a client. Now in cleaning the area of the vulva of the client, the genital area, the first stroke is the farthest away from you, like for example here. So you have to clean it from the top, going down, one stroke, do it to the other side, one stroke, and then wash your cloth, and then at the center. All right, repeat it again, one more stroke like this, and then you have to make sure that you're cleaning the clitoris in the vaginal area. Okay, do not use cloth the same time. I mean, if necessary, you have to use different cloth in cleaning the area, because you know what, uh when you're using it, the pathogens, you just keep putting it back, so they're more prone to UTIs. And it's unhygienic to use it at the same time. All right, so uh you have to clean it, rinse it very well. If it's soapy, it's still soapy, you have to do the same stroke again until it's clean, going back. All right, one stroke from the right farthest to you, one stroke from here, and from the center. You have to do it again and repeat it again. All right, okay, and then pat it dry. And you can also observe if there's anything like redness or any irritations on the vulva of your client. Now, in in cleaning the back of your client, so you have covered your client, you're done with the perineal care for the female client. You can proceed to the back. You can ask your client, hello, Mrs. Smith again. So I'm gonna clean your buttocks area. So I'm gonna position you to your left, to your right, which is away from you. So you could ask them to, to move their back, or you just can help them. Now in cleaning the buttocks area, using a cloth again, you have to start from the cleanest to dirtiest, from the vagina going to the anus area. You have to repeat it until it's dry, it's clean, and then pat it dry. And then after that, you have to remove the waterproof pad, discard it. Okay, discard. And then you can also discard your gloves and reposition your client for that. Now, that's for female. Now we're going to discuss about on how to clean the male genitals. Okay, the same procedure for the female on the perineal care. Now, you have to make note, you have to remember that if your client is uncircumcised, you have to retract the penis. Now, now for example, this is the penis of the client. Now, if the penis of the client is uncircumcised, you have to retract them. Yeah, you have to retract so you can see the head. Now, in cleaning the penis of a client, you start with the urethra and then going down, circular motion going down. Why is it important to retract the foreskin of the client? Because there is a white thing in here. I think it's we talk all about schegma or something like that. That is the one that we're gonna remove. So you have to clean it in the urethral area, circular motion going down. All right. And of course, if your client is circumcised, you can just easily do it like this in a urethra going into the circular motion of the head. All right. Next, after that, you can now do downward stroke for the shaft. Do it like this. Okay. Repeat the procedure until the penis is clean. And then for the scrotum, you have to ask your client, like for example, Mr. John, can you flex your legs for me? So if your client is able to flex, it's good. And if it's not, you can help them. For the scrotum, you have to make an observation or make a note if there's any, you can see anything that should be reported. And then so you have to clean it, the scrotum very well, rinse it very well, and pat it dry. Now for the buttocks area, you have to ask your client to turn on their back or help them turn away from you. And then again, you have to clean this to the cleanest to the dirtiest, from the scrotum going to their anus. Do it many times. If you see it's well clean enough, then you can pat it dry. Now you remove the waterproof pad, and then remove your gloves, and then perform the post procedural care. Now in post procedure, you have to make sure that the client is safe and comfort by make sure that the side rails of the bed are in, your client is well covered, and then what else? Make sure that the cowbell is within reach. You have lowered your bed, and then make sure that you have cleaned the area where you use. You have to disinfect the table, and then you have to make sure that the soiled linens are in the proper bin, and you have to make sure that the supplies are in proper places, and then you can do the hand hygiene and for reporting and documentation.